I express my sincere reverence to our immortal leader, Puratchi Thalavi Amma. And once again, I thank you for allowing me to speak on the Mental Health Care Bill 2016. Madam, Tamil Nadu is one of the best states in the country in providing medical care for mental ill people. Madam, the State Mental Health Authority Tamil Nadu, SHMATN, was formed in 1994 when Puratchi Thalavi Amma was the Chief Minister. The authority is mandated with the responsibility of developing, regulating and coordinating mental health service in the state of Tamil Nadu. Madam, the multi-stakeholder in this arena include the government mental health hospitals, besides the private organization including NGOs, rehabilitation homes and de-addiction centers, etc. The Institute of Mental Health at Chennai is the major hospital under the government sector offering all mental health related service. Further, the development of psychiatry headed by a senior psychiatrist are functioning in all government-run medical college hospitals in Tamil Nadu, taking care technique psychiatry to the medical students and providing treatment to mentally ill patients. These apart psychiatry units are being run in the entire district headquarters hospital in Tamil Nadu. Therefore, I urge the union government to allocate more funds and support for Tamil Nadu. Insofar as private sector is concerned, there are a number of private mental health nursing homes, hospitals for which license are granted by the Director Institute of Mental Health. Madam, in short, the SHMA is striving to enhance the level of participatory role of government mental health hospitals, units, private organization, and the society at large in taking care of the mentally ill patients. In addition, this authority strive to integrate the various agencies involved in the mental health care and adopt a bottom-up approach in resolving the issue involving mental disorders. SMHA aims to increase the level of awareness and acceptance of the people towards the mentally ill patients and to provide a platform for harassing their potential in order to bring them in the mainstream of the society. Mental health first aid has been defined as the help provided to a person developing a mental health problem or in a mental health crisis. The first aid is given until appropriate professional treatment is received or until the crisis resolves. Mental illness are psycho-socio-biological based disorders which interfere with an individual's ability to think, feel, act and relate within the standard norms of the society. Severe mental illness are more common than cancer, diabetes or health diseases. Mental illness can strike any person at any time. World Health Organization WHO defines health as physical, psychological and social well-being. According to WHO, throughout the world, 1% of the population suffers from severe mental disorders, 15% suffer from common mental disorder, and alcohol and substance misuse constitute 3 to 5 of the population. Nearly 4% of psychiatric illness. Among children and adolescents, 1% suffer from some degree of general intellectual functioning or learning disorders. About 5% of children suffer from emotional and behavior disorders. While applying above statistic, considering the population of India, approximately 1.2 crore people suffer from several mental illness. 20 crore persons suffer from common mental disorders. 50 lakhs persons above the age of 60 suffer from genetic psychiatric disorders like depression. 2 lakhs children suffer from subnormal intelligence and learning disorders. 6 crore children suffer from other childhood psychiatric problems and 6 crore people suffer from alcohol abuse and substance misuse related problem. While looking into the present scenario of human life, it has become more and more complex and competitive. The number of stressors are on increase and the ability to cope with the stressors and tolerance are on decline. This in turn leads to increase in proponents of production of psychiatric problem in vulnerable individuals. So, social stigma in common pertaining to mental illness, especially in rural areas. In addition, ignorance, fear, and faulty attitude regarding mental illness are highly prevalent in rural and semi-rural areas. Madam, while the magnitude of the problem in relation to psychiatry illness is enormous, the mental health care facility in Tamil Nadu is not adequate, not evenly distributed, with more facilities available in urban area than in rural area. So, to resolve the above issue, mental health policy for Tamil Nadu state has been evolved under the visionary leadership of Honorable former Chief Minister Puratchi Thalaivi Amma. Mental health care facilities have to be made available in all parts of the country, even in the most rural areas, and are to be distributed evenly both in rural and urban areas. Mental health care professionals have to be increased in their numbers. Psychiatrists, psychiatric social workers, clinical psychologists, and psychiatric nurses. Mental health care has to be integrated into all levels of general health care. Rehabilitation service for persons with chronic mental illness have to be expanded so that their maximum potential can be developed and their integration into community life can be facilitated. Madam, district mental health program is being implemented in 123 districts across the country with the aim of creating awareness about mental health. It is early to direct the treatment and removing the stigma associated with it. Madurai district of Tamil Nadu has the distinction of providing highest quality mental health care services, say an evolution of the district mental health care program. The outstanding performance is primarily attributed to regular inflow and availability of medicines at healthcare, while satisfaction with the quality of service is an average of 7.3 on a scale of up to 10. Madurai attained a source of 9.6. Madam, evolution of further expansion was done by the ICMR, a division of Planman Consulting India Private Limited. It visited 20 districts where the DMHP was being implemented and 5 non-DMHP districts. The results show that the expenditure on training and IEC component that require a lot of groundwork. Coordination and network in the community is below par in most of the districts. The result also showed that only 1/3 of the district utilized and funds made available under the program, while the remaining used only 37 to 47% of the money owing to administrative delay. Difficulty in recruiting and retaining qualified mental health professionals. Madam, I urge upon the Union Government to enhance the medical care facilities for mental health care program throughout the country. Thank you, Madam.